Elizabeth II Charles, Prince of Wales Elizabeth II Boris Johnson Dominic Raab Elizabeth II the Lord McFall of Alcluith, Sir Lindsay Hoyle Sir Keir Starmer Supreme Court the Lord Reid the Lord Hodge The Department of Health and Social Care is the UK government department responsible for government policy on health and adult social care matters in England, along with a few elements of the same matters which are not otherwise devolved to the Scottish Government, Welsh Government or Northern Ireland Executive. It oversees the English National Health Service. The department is led by the Secretary of State for Health and Social Care with 3 Ministers of State and 3 Parliamentary Under-Secretaries of State. The department develops policies and guidelines to improve the quality of care and to meet patient expectations. It carries out some of its work through arm's-length bodies, including executive non-departmental public bodies such as NHS England and the NHS Digital, and executive agencies such as Public Health England, the UK Health Security Agency and the Medicines and Healthcare Products Regulatory Agency. The Department of Health was formally created in 1988 through the Transfer of Functions Order. Like many others, the department with responsibility for the nation's health has had different names and included other functions over time. In the 19th century, several bodies were formed for specific consultative duties and dissolved when they were no longer required. There were 2 incarnations of the Board of Health and a General Board of Health that reported directly into the Privy Council. Responsibility for health issues was also at times, and in part, vested in local health boards and, with the emergence of modern local government, with the Local Government Act Office, part of the Home Office. In the early part of the 20th century, medical assistance was provided through National Health Insurance Commissions. The first body, which could be called a department of government, was the Ministry of Health, created through the Ministry of Health Act 1919, consolidating under a single authority the medical and public health functions of central government. The coordination of local medical services was expanded in connection with emergency and wartime services from 1935 to 1945, and these developments culminated in the establishment of the NHS in 1948. In 1968, the Ministry of Health was dissolved and its functions transferred and the Department of Health. After the 2018 British Cabinet reshuffle, the department was renamed the Department of Health and Social Care. The department's headquarters and ministerial offices are at 39 Victoria Street, London. The department moved from its previous location in Richmond House, Whitehall in November 2017. Its other principal offices are Skipton House, Wellington House near Waterloo Station and Quarry House in Leeds. Wellington House is now mainly occupied by staff from the department's arm's-length bodies. New King's Beam House near Blackfriars Bridge was formerly a Department of Health office prior to the expiry of its lease in October 2011. Alexander Fleming House, Hannibal House and Eileen House were previously used by the department. The archives are at Nelson, Lancashire. As of March 2021, there are 7 ministerial posts at the DHSC, including the Secretary of State, 3 Ministers of State, and 3 Parliamentary Under-Secretaries of State. The term Health and Social Care Minister refers to any minister junior to the Secretary of State for Health and Social Care. The ministers are as follows: sponsorship of NHSE, NHSI, NHSBSA, sponsorship of NHS Resolution, CQC, MHRA, NHSX, NHSD, sponsorship of HRA, NHSBT, HTA, HFE, HE, sponsorship of FE&FSA, sponsorship of NHS Blood and Transplant, the Human Tissue Authority, the Human Fertilization and Embryology Authority, the Medicines and Healthcare Products Regulatory Agency, the National Institute for Health and Care Excellence, NHS Digital, Health Research Authority, NHSX, NHS Business Services Authority. The Permanent Secretary at the Department of Health and Social Care is Sir Christopher Wormold KCB, who was appointed in 2016. Previous permanent secretaries, following the resignation of Sir Nigel Crisp in March 2006, A separate post of Chief Executive of the National Health Service in England was created, held by Sir David Nicholson, following the Health and Social Care Act 2012 and the creation of the independent NHS Commissioning Board, known as NHS England. This post has evolved into Chief Executive of the new organisation. As of the 1st of April 2014, the incumbent is Simon Stevens. The department has 6 chief professional officers who provide it with expert knowledge and also advise the ministers, other government departments and the Prime Minister. The Chief Medical Officer and Chief Nursing Officer are also directors of the department's board. The department acts as a steward for the health and adult